Hello and welcome to People for People. I'm Twanda Black, your host. And joining me today, Dr. Michael Obiekwe. He is the founder of Arms of Care International. How are you today?
I'm fine, Twanda. Thank you for having us in People to People television.
It is my pleasure. Tell us a little bit about yourself.
Well, like you said, my name is Michael Obiekwe. I started at Arms of Care International as a medical mission outreach organization. We've been registered since 1994. We've been going on medical mission trip, either alone or in partnership with other organizations since then. And one of our vision is to establish medical clinics in rural parts of the various parts of Africa or even in this country. Make sure we provide health care to people who do not have the access or who do not have the wherewithal. And most times we do this free of charge. We've gone to various parts of Africa. Even in this country, we also provide free clinics, either in partnership with other organizations, or we're hoping when we can have our own facility and start one ourselves. We're actually working towards that.
Tell us about your training and where you came from.
Well, born in Nigeria, trained my medical education was in Nigeria, and eventually did a residency in surgery. Was board certified in West African College of Surgeons, and then after that came into this country and had my training at Emory University as a family physician. And after that, I've been working as a family physician in this country. Started a practice at Land Africa Medical Center that's been thriving for the past 5 years now.
Where's your practice?
Located at Riverdale, 217 Medical Way in Riverdale, and that's where my practice is. Again, it's a family practice establishment.
Were you really surprised about the differences when you came to America in the medical field and as far as what people have and what people don't have?
Obviously, there is a world of difference compared to Africa and here. Here you have insurance companies that are there to stand for people who can afford the insurances. Unfortunately, there are quite a number of people who can't afford insurance.
Even still, right.
And that is a problem because America is perceived outside this country as being able to provide to its own people, provide for everybody. But the reality is that this is not so, given the system. And when we found out that this wasn't so, especially in my practice, there are people who are really in their need, and they can't. And, we have, in my practice, people who we know cannot pay, and they are in their need of medical attention.
That's right.
We've offered free service to those people. And when we started the Arms of Care, we started having free clinics. We partner with Hands of Hope to provide free clinics. We mentioned Hands of Hope. We're located in Stockbridge right now. Because we're in Riverdale, we're looking forward to a time we can have a facility in Riverdale where we can offer, at least for a start, once a month, free medical care. And then thereafter, we can do that more often as we have more volunteers join us.
And that's whatever someone may need.
Oh yes, whenever someone may need. We also want to partner with a few other big hospitals. And there are people who are willing, actually. As we speak, there are some surgeons who have indicated intention to go with me for my next medical trip to Africa. Haven't seen what we did, and they are willing to go give their time, their skill. There are people in this country who are willing to give their time and their skill to people who are less fortunate.
How are you making it happen in Africa without the facility?
Well, before we go, we make sure that there is a place that we can offer the kind of services that we want to offer for a particular mission trip. We have had to consult under the tree. Actually, in one of the mission trips we went, there were no places in the area we went. We cleared under the tree because of the shade that we wanted, and we consulted under the tree. Our pharmacy, MedShift Pharmacy, is besides, and then people who were with us on the trip, we see them, make a diagnosis, and then send their prescription pads to the pharmacy.
Wow.
The pharmacy gives them the money. Provides the medication. Before then, usually we study the background of the place to find out what is the common disease in the area, what are the prevalent diseases in the area.
Okay.
That helps us in the selection of medication that we're going to go with. And we also always try to make sure we have a local doctor that we can partner with for follow-up of the patients that we've seen. That's what we do. Areas will have to operate. We must make sure that it's a theater facility. May not be wonderful, but we make sure that it's a theater facility. We just came back last month from Liberia. We had 27 surgeries in the place. Wow. There was a theater facility, and all this we do free of charge with the supplies that we go with. We usually make a contact with somebody, a local host, that part of their job is to announce that we're coming, and to announce the things we're going to be doing specifically. If there are facilities for surgery in that area, and then we would include, surgical operations.
Okay. Well, you know what? Hold that thought. We're going to come right back with more of People for People.